whether it is Sama or Nirama first. And in Nirama condition, when after doing Vidha Karma, first we have to do Vidha Karma, then we have to do Agni Karma. If at all the pain is not reduced so much, sometimes what happens is, for example, in knee joint pain, it is severe, so severe that a person is not able to take one step ahead. So what we have to do is we have to do Vidha Karma first, and then we have to do Agni Karma on that particular points. And yes, while doing Agni Karma, we have to not do exactly on that particular point where we have did Vidha Karma. We have to just either below or above or on either side we have to do just few millimeters apart from that. Why? Because doshas are getting expelled out where we have punctured the vein or where we had done Vidha Karma. So we have, if we do Agni Karma, there are chances that we block that path and the what you say pain again increases. Hope it is clear. Yes. Okay. Karana Roga is like, see, first, basically it's very easy. Where the ear is attached, this point, if we directly go in a straight line behind the ear, and where is the Keshanta Sandhi, that is Karnasya Upari Karna Paschat. In Tika they have mentioned Karnasya Upari Karna Paschat, behind Karna. And where till where it can go till here, it can go till here also, but it should be only when it touches the keshanta sandhi, wherever there is a line where of the hairline, what we say, behind your ear. And one more is the vidura marma over here, just below that. There is a process, there is a bony feeling you can see. Just below that, we have to do Vidya Karma. But yes, before trying these Vidya Karma, please learn it from a well trained practitioner, or else you are going to harm the indriyas of patient. Urdhwa Jatru is most important. Just by looking at this lecture, don't try to do Vidya Karma if you don't know. Yes. Yes. Any other questions? Hmm. Gandha Grana, mainly again we have to see which dosha is present over there. So again, if it is Kapha dosha, mostly both. First, we have to do Vidha on the tip and two Upanasika. Then we have to do on the same place Agnikarma. And if at all it's due to Pitta or Vata dosha, only Vidha Karma can be is sufficient usually. We have to see if there is a aghat and the gandha grana is there, or whether there is due to what you say, blockage in the srotases. Certain people are like, few people consume more of junk, and then suddenly their sensory organs start deteriorating. So in such condition, there is a avarana and there is a blockage in the srotases. So that we have to clear it up. So there first we have to do Vidya Karma, and how much over srava of rakta is going on, we have to go it, and then we have to do Agni Karma, so that further dilation of the srotases, minute srotases present over there happens, and the passage of like what pancha tanmatras we grasp through our indriyas is clear, and that time the perfect jnana will occur. what was the second part? Huh. Okay, so usually this uh, 26 and half needle is what we use in most of the cases. So you can see here, if at all it is visible, 26 and half needle with brown color base. So the length of this is almost 11 mm. So this is the needle. So when we insert it halfway, it is Ardhavrihi. When we insert it full way, it is Purnavrihi. One more needle it is there, which is 24 number needle. 24 number needle is 2 Vrihi. So this is double of this, what you say, 24 and half, sorry, 26 and half needle. So when we see exactly half of the size. Yes, I'm just focusing on the white background so that needle is visible. Is it visible? Okay. Now, yeah, just a second. Now it is visible, right? Yeah. So see those two needles. It is one is one Vrihi Pramana, which is smaller one, and exactly the second needle is two times of that one Vrihi Pramana. So two Vrihi Pramanas exactly. So there are some cases, especially during sciatica cases, we use two Vrihi Pramana needle, and what you say, we do the Vidha in sciatic notch usually, where we have to go deep inside the tissue. So that time that needle is used, or else most of the time the small needle 26 and half is only used. This is because in most of the places we have to do only Ardha Vrihi Pramana, and it can guide you to easily to do that particular Vidha. Hence, this needle is used the most, 26 and half needle. Yes. Okay, Shirashula. Yeah, I forgot to add the slide. I'm sorry. Okay, first thing we have to categorize which dosha is present in that particular Shirashula. So basically now it is Grishma Rutu, and most of them are what to say, experiencing the Shirashula of which is more of Pittaja kind of Shirashula. So for that, first we have to do Bhrumadhya, exactly in between the eyebrows, and then Kapala. So how the Kapala we can measure is, there is one angle on your eyebrow. In one third part of your eyebrow there is angle. So exactly 45 degrees when we go above, the where we meet at the Keshanta Sandhi, that is the Kapala uh, point or with the karma point. So Bhrumadhya and Kapala we do, and most of the time the what you say, Shirashula goes off. And if at all it is due to more Guru Bhojana, what you say, again, Kapakara Ahara, there Agnikarma is needed. Basically, we have to, basic rule, we have to segregate what kind of disease it is. Is it because Ushna Nidanas, or is it because of Shita Nidana? If there is a Shita Nidana involved, we have to see whether it is Ama related, Sama or Nirama. If it is Sama, only Agni Karma. If it is Nirama, Vidha Karma along with Agni Karma. And if it is due to Ushna Nidanas, only Vidha Karma, because we have to do Rakta Sravana only. As Pitta and Rakta are Ashraya Ashraya Bhava. Yeah. Sorry. Yeah. So there should be minimum of 6 to 8 hours of gap in between two sittings. What we do is I practice is like see Vidha karma can be done on daily twice basis also. If it is the disease is more severe, you can do it twice a day, like morning once and evening once. But if it is like normal or a moderate disease where patient is about can do his or her household work or daily routine work, so you can ask patient to come daily or weekly thrice or weekly twice also, depending on the severity. But minimum gap to be given in between two with is 6 to 8 hours. That you have to see. Yes. Performing a Vidha and Agnikarma both. Yes. So basically, what happens is based on the disease, what we are doing, the action changes. So what we generally think that Agni Karma is used to is when we do Agni Karma, dilation is seen, but that is wrong. Why? Because as I explained in while explaining the Sharira Rachana slide, we do Agni Karma on the Parshni, but still there is we see there is a contraction of intestines in the Pakvashan. So depending on what disease it is, the what you say mechanism of Vidha and Agni Karma differs. But for Vidya Karma, basically it is what is there. Like we have to do, we have to take out the doshas from that particular srotas. That is the basic rule. And in Agni Karma, to stimulate or to heal that particular nerve or that particular nerve ending, we do Agni Karma, especially with Swarna Shalaka and also with Rajata Shalaka. If the Vyadhi is extremely due to nerve and nerve related this thing, then we use Rajata Shalaka because it heals and it does the healing of that particular nerve and bring back its original property or original what do you say functionality of that particular nerve. Rajata Shalaka is used in that particular Vyadhi, but most of the time we use Swarna Shalaka. And Agni Karma based on what dravya you use matters over there. So, like 2 to 3 days before only, I got a patient of frozen shoulder. So I did with. They have told if you do with the karma, the in many cases you won't see proper results. So same I was experiencing. Then there is one more thing that in Snigdha Agni Karma or Guda Agni Karma should be used when there is the involvement of Snayu. So I did Guda Agni Karma where there is a tenderness scene, most tenderness scene. I did on that particular point using Guda. Like I heated the Guda and just applied it for a fraction of second, not even a second, fraction of just applied and just take it out. So immediately the pain vanished and there was no scar on the tissue skin. So that fast it is, and based on the dravya, what we use is the most important over there. Rather than by using any shalakas, the dravya which we use is most important. Hope it is clear. Any other questions? Yeah, yeah. CA cases. So again, we are diverting from today's topic. CA cases, yes, we can do it. Agnikarma works very good in CA cases where we can directly cut out the tumors which are visible for us. Uh, CA of mouth, yes, I am telling that only. I know one of my colleague, Vaidya Pankaj Tiwari. Like you can check his Instagram handle also. He has many such videos where he has directly done chedana of the CA cancer mouth, like whatever the growth is seen, without any local anesthesia. He uses what you say ice as a local anesthesia, and within few seconds only he just takes it out, the extra growth. So there is no need of local anesthesia giving. Only by placing a ice or ice pack for a few minutes, a few seconds, the numbness will be seen in that particular region, and you can during that time you can just do chedana of that particular tissue from that particular part. So Agni Karma works best. Yes, Vidha Karma also works. Only the thing is, what is the samprapti of that particular cancer? You have to first see. See, there is one case I'll just tell. A person was having some abnormal growth. I guess she person was female and she was having abnormal growth on her ovary. It was not confirmed yet as a cancer, but the it was just as such like some 2 to 3 centimeter only. It was neither growing neither coming down. So what doctors said it was to do biopsy and see what actually the growth is. But there is this is only what the mistake people do. So when you do biopsy, you try to disturb that particular tissue over there, and it triggers further to spread it all over the body. And similar thing happened to that particular patient only. So after biopsy and after few days, like say around 15 to 20 days, the tissue had spread to other organs in and around that particular ovary. So be careful before going for biopsy. And sir, they came to sir, and as there was a aghata to that tissue, we can consider it as Vata Rakta Samprapti, where the mainly Rakta Dhatu and Vata Dosha has been what you say Dushti is seen in that particular these two entities, and because of which sir took Kshipra Marma Vidha, 2 angulis above the Kshipra Marma Vidha, and the results were seen along with internal medications also. So, based on how the samprapti of that particular CA goes, the Vidya points changes. So, similarly, if it is in Gala Pradesha, the Jivha Mula and Gala Vidya, Hanu Vidya can be done. So, based on what it is, we can consider. We have to just prick and take it off. No need to keep on that particular site. Hmm. Yes, yes. Again, we have to first see what are the lakshanas. Rather than going for modern diagnosis, we have to see lakshanas, what a patient is experiencing. See, my guru, the Vaidya Chandrakumar sir, is having ophthalmoscope with him. So what? Once we asked him, sir, what do you see while examining a eye? What is on retina, or what exactly do you see? So his lecture is there on YouTube. He takes everyday classes, live classes. So in one of the lecture he has explained it. So when I see into the eye, I just see for the doshas, what is there inside the eye. See, sometimes when we see inside the eye, it is full red, bright red, or something yellowish tinge. So that time we should consider it as a pitta dosha. And sometimes it is full milky or full blurry or something which is blur. So there we can should consider it as kapha dosha involvement is more in that particular eyeball or eye. And sometimes it will be unpredictable, like sometimes some weird patterns will be seen in the eye. That time we should consider it as vata dosha is predominant over there. So sir told us like that. Sir told I am not an expert to see an eye through ophthalmoscope, but I see it in an Ayurvedic way. What I want to see, examine in that, what that I see in my own way, like in Ayurvedic way only. And based on what dosha is present, I perform the Vidha Karma, Agni Karma, and treat that condition accordingly. So, what exactly? See, now in according to Patala, I am telling. So, first is there are how many Patalas? Can anyone uh, put it in the comment box? 4, 5, 8. How many Patalas? 5 Patalas. Yes. Anyone else? Any other answers? 6 Patalas. 6 Patalas. Okay. So yes, we will see according to the patalas. So basically, it is first and second patalas. When we see it is Bhrumadhya, Apanga, and Bhrupucha. Then next, yes, it is 6 patalas only. Then again, for next 3 patalas, sorry, first 2 patalas is Bhrumadhya and Apanga only. Then next 3 patalas, Bhrumadhya, Apanga, and Bhrupucha. And when the Vyadhi goes more deeper and Drishti is involved in that particular Vyadhi, we take Upanasika. So this is usual sequence of Vidha for eyes in eyes related disorders. So based on that, we should do Vidha. Yes, Vidha Karma, Agni Karma, Vaidya R.B. Gupte sir's book is there. It is there in Hindi, English, and Marathi. So you can go on their website. You can type on Google Vaidya Gupte Memorial Foundation, and you can order it from there. So this book, this is old version. New version has come, where many updates are being updated in this book. You can buy it from there. But yes, again, it is a basic thing. Before practicing, I would like to tell, go to any Vidya Karma, Agni Karma practitioner who is near you. If at all you have chance to learn under Dr. Chandra Kumar Deshmukh sir, it is your what you say, you are good, you are lucky enough, because there you see more than 500 patients per day which are treated by Vidya Karma and Agni Karma. All kind of like patients are there, starting from pediatric till geriatric. So if you have that what you say, fortune to learn under him, it's excellent. Or else by like you can learn it from any other practitioner who is practicing Vidya and Agni Karma with proper knowledge. Because nowadays, when we see, there are many videos on social media platform where people are doing irrelevant Vidya Karma and Agni Karma, and they are calling it and giving it the name. But it is not so. They are like putting needles in a row above the eyebrows, below the eyes. All such things are being practiced, but it is not the proper Vidya Karma. It is not at all a Vidya Karma. So you should learn it from a well-trained Vaidya. Yes. Yeah, exactly. I guess within 1 week of treatment, I guess less than 1 week. Yeah. So yes, yeah, yeah. I'll just share that slide. Okay. Yes, I'll share that slide. Yeah, is it visible now? Uh, Yes, and again to show the public that Ayurveda is not slow at all. Yes. One thing, if I have missed anything in my today's presentation, I'm so sorry. And whatever you have gained the knowledge is because of my gurus who have imbibed this wonderful knowledge in me. So nothing is mine. Everything is I have gained from my gurus. I am presenting it today, and any mistakes today is because of me. So please forgive for that. Yes, yes, yes. Thank you so much. Thank you so much for inviting me for giving this session, and hope we will continue these sessions today further with some more new topics so that we can educate people, young Ayurvedic minds who are about to practice or who are practicing. We can, what to say, we can give them a confidence. Yeah, Yeah. Thank you. Yeah, yeah. Thank you so much. Yes, sure. Okay. Okay.